fibroids are smooth muscle tumors. They come from a monoclonal cell, or one cell that divides and divides and divides. They're genetic, and so 25% of women have fibroids. Very common, especially in Afro-American, Asian, and Hispanic women. They usually develop in one's late 20s, 30s, and sometimes in the perimenopause can grow. And so they are sensitive to estrogen. They can grow whenever estrogen is present, in other words, during a pregnancy, for instance, or during fluctuations of estrogen. A lot of women have them and do not have symptoms, but symptoms depend on where the fibroids are, the location of the fibroids in the uterus. So the uterus is a muscle. It has a lining, and it's in that cavity which will expand, which if you're pregnant, that's where the baby is. Fibroids can be submucosal, which can grow into that cavity or lining, and those are the ones that typically cause bleeding. They can be in the wall of the uterus or intramural, and those are the ones that just cause a growth of the uterus, and they can be also on the outside of the uterus, which are called submucosal. If the uterus has them in the walls, they tend to cause more pain with the menstrual cycle. If they're on the outside and the uterus gets quite big, they can press on the bladder, and so that people can also present with lots of urinary frequency, urgency. And if they're on the back side of the uterus, for instance, they can cause more back pain, constipation. So it depends where they're located. If a fibroid is on the outside of the uterus, high up, it may cause pain as it grows rapidly with pregnancy, and it can degenerate. So that's when it grows rapidly and outgrows its blood supply, and that can be painful. It can cause preterm contractions and preterm labor, but not always. But for instance, if it was in the lower portion of the pelvis and it grew large, it may impede a vaginal delivery if the baby actually can't descend into the pelvis because of a large mass.